Robots are changing the operating room with the help of skilled surgeons. The technology allows so many more patients a minimally invasive procedure that comes with plenty of benefits. Trinity Health has hundreds of robotic surgeons across the state. Dr. Eric Crable, he's one of them joining us today. Thanks so much for being here.
Thanks for having me.
Let's talk about robotic-assisted surgery and what that looks like.
Yeah. So it's a newer technology, but in all reality, it's been around for 20 years.
Sure.
We have many different types of robots throughout the state, the Da Vinci surgical system being the most commonly used. It really is allowing us better opportunities to provide this care for patients.
Okay, so let's talk about what it looks like in the operating room for you, because it looks different,
Sure
right?
does, yeah. So the surgical system itself, it's a robot, right? You can imagine has multiple arms that are coming out of the console. Once that is docked and ready to go for the patient, the surgeon, like myself, we're actually sitting down at a console using much more advanced technology, better camera instrumentation and visualization, giving us a 3D view essentially inside the patient. The precise movements that we're afforded with this new technology is really amazing. So I'm able to use my two hands to operate 4 arms, including my legs, to provide the surgery.
Wow. Yeah. So, I mean, you get 2 extra arms, so automatically a benefit, right?
Of course.
Let's talk about the different surgeries that this can be used for.
So my personal specialty is general and bariatric surgery. So we're offering, any major operation essentially within the abdominal cavity, but many other specialties are able to utilize this robotic system. So thoracic surgery, urology, gynecology, even transplant surgery. These things are all offered to patients essentially to give them the outcomes that we're looking to achieve with less pain, really, fewer complications, and good results.
Well, and let's talk more about the benefits to the patient.
Yeah, of course.
Yeah.
So historically, you can imagine surgery was much different. We had much bigger incisions, which was quite painful, actually increased the risk sometimes of complications. And so these very, very small incisions are allowing us to reduce those risks and complications and get patients back on their feet much sooner.
Yeah, I mean, a big difference, right?
Of course.
Absolutely. And then they can just go to their doctor and find out if they're a candidate for this.
Correct, yeah. If a patient is a candidate for laparoscopy, which is a minimally invasive surgery, oftentimes robotic surgery is the next step. Multiple specialties, like we mentioned, can offer this, and there's over 270 surgeons throughout the state.
Perfect. Wonderful. Thank you so much, doctor. We appreciate it. You want to learn more? TrinityHealthMI.org/robotics.